Hi everyone, my name is Cassidy Page, and today I'm going to be presenting on the importance of visual literacy in art therapy. So to give you guys some background, according to Cherry 2021, art therapy is the use of artistic methods to treat psychological disorders and enhance mental health. Art therapy is used to treat a variety of mental illnesses in patients through the analyzation and creation of art forms such as drawing, painting, and sculpting. While this form of therapy is highly beneficial, it is often misunderstood. Art therapy is valuable to the field of psychology because it is accessible to all, promotes healthy self-expression and coping, works to relieve stress and increase self-esteem, and improves symptoms of both mental and physical illness. Both clients and therapists who utilize art therapy are more likely to reap the full benefits of treatment if they are visually literate. Visual literacy requires an individual to decipher and decode complex forms of imagery, as well as the contextual, cultural, ethical, aesthetical, and intellectual components behind it. Overall, visual literacy helps to make art therapy a more successful and beneficial treatment. Part of what makes art therapy so unique is its ability to fit the individual. The large range of activities that fall under this method make it accessible for people of all ages. For example, you may see a child participating in art therapy by finger painting, or an adult participating by viewing an art gallery at a museum. Diverse activities allow this art to be practiced at a variety of locations, and according to Cherry 2021, they can be practiced in mental health offices, art studios, universities, outdoors, mental hospitals, and so on. Art therapy can even be practiced independently or with the help of a therapist. In addition, if an individual is visually literate on top of practicing art therapy, they are able to analyze a variety of images and interpret meaning on a much deeper level. Taking part in complex analyzing and communication skills, such as those offered through visual literacy, have been shown to improve well-being. According to Cherry in 2021, art therapy has been shown to reduce symptoms of mental illnesses such as anxiety, depression, eating disorders, PTSD, and substance use disorder. As previously discussed, visual literacy skills in relation to understanding, analyzation, interpretation, and the creation and use of images is a far greater advantage added to art therapy. Because visual literacy helps to build these skills in art therapy, clients and therapists who utilize visual literacy are better at reducing stress and in turn have a better well-being. The ability of an art therapist to successfully analyze a client's artwork is extremely important. Artwork is known to house the emotions, thoughts, and experiences of individuals who create the art. As an art therapist, you must be able to interpret what the client is expressing. Clients may not always feel comfortable expressing their emotions or experiences out loud, or may have trouble putting them into words in general. Instead, they may express these deeper emotions throughout their artistic work. Using visual literacy to interpret these things gives the therapist an opportunity to learn more about the client and in turn create a more successful and unique treatment plan for each individual. Many individuals struggle to utilize positive coping skills and emotional outlets. They might use negative coping skills like substance use, self-harm, or over or under eating. Art therapy offers a healthier alternative to cope with negative emotions. According to Reynolds 2020, when art therapy is utilized by students, it has been shown to decrease symptoms of mental illness, decrease absences from class, and even increase grades. Using art therapy as an emotional outlet and coping mechanism can be greatly strengthened with the addition of visual literacy skills. With a better understanding of how art is used to express certain things, an individual can more successfully portray their own emotions and feel the full effects of treatment through art therapy. Another major advantage of art therapy is its ability to reduce client stress in a unique and enjoyable way. A study discussed by Frank Otto in 2016 used cortisol to measure the effects of art therapy on stress levels. Participants began by having their cortisol levels measured, which is a key indicator of stress. After, they practiced some form of art therapy for about 45 minutes, such as painting, sculpting, or drawing, and then afterward, their cortisol levels were measured again. They found that 75% of participants experienced a decrease in cortisol levels, suggesting a significant decrease in stress. While art therapy can be beneficial in reducing stress on its own, those who are visually literate will be even more successful. Knowing how to express pent-up stress and emotion through art therapy allows an individual to better sort through complex problems and better process an experience or emotion. On the topic of self-esteem, a study by Nader and Musa, 2012, discovered that engaging in art therapy gives the observer a self-sense of value and meaning as they explore the analyzation and creation of art. They suggested that the aesthetic value of observing and creating artwork itself can boost an individual's self-esteem. Specifically, it gives an individual a chance to freely express themselves in a creative way. Individuals may feel more intelligent after observing and analyzing the works of others, or they may feel more confident in themselves after creating something they like or are proud of. According to research conducted by Susan Clifton in 2017, when experiencing or thinking about a traumatic event, the left side of the brain, associated with speech and logic, tends to shut down. This leaves the right side of the brain, associated with automatic and emotional arousal, to combat the memory. Through art therapy, you are able to reactivate the left side of the brain. This allows you to use a full functioning and healthy mind to process complex thoughts and emotions and communicate them whether out loud or through artwork. Visually literate individuals show even more success in reactivating the left side of the brain and sorting through complex emotions and thoughts, as visual literacy gives them the knowledge and ability they need to express these things through visual media. In addition to decreasing mental health symptoms, art therapy has been shown to also reduce symptoms caused by physical illness and disorders. A review by Holly Teray through Michigan State University in 2017 revealed that art therapy had significant positive effects on a multitude of physical illnesses. Adult and child cancer patients with chronic pain showed a great decrease in pain and increase in well-being after participating in sessions of art therapy. In addition, older individuals suffering with memory and function loss due to dementia showed an increased physical and mental functioning, as well as improvement in memory after also participating in trials of art therapy. As I have discussed many times now, knowing how to effectively express and portray one's thoughts, emotions, and experiences through their own art in the work of others allows a person to be more successful in the practices and benefits associated with art therapy. To conclude, both clients and therapists who utilize art therapy are more likely to reap the full benefits of treatment if they are visually literate. This is because visual literacy aids in art therapists and their clients in utilizing healthy coping, reducing stress, improving physical health, enhancing emotional processing, analyzing image media, and increasing well-being. And here are my references.